Imagine waking up one morning and realizing you can't remember the conversation you had yesterday. At first, it feels like a small lapse, something anyone might brush off as ordinary forgetfulness. But slowly, the lapses grow. You begin to lose track of important dates, forget familiar places, and struggle to find the right word. Over time, the faces of friends and even the people you love most starts to fade from recognition. This is the heartbreaking reality of Alzheimer's disease, a condition that doesn't just steal memories but gradually takes away independence, personality, and identity itself. It is the most common form of dementia, affecting millions of people worldwide, and its impact reaches far beyond the patient. Families watch, often helplessly, as the person they once knew slowly disappears before their eyes. Alzheimer's is not just a disease of the brain, it is a profound challenge for entire families, a test of patience, love, and resilience. Understanding how it begins, how it progresses, and what can be done to ease its burden is essential for everyone, because with an aging population, its shadow touches more and more lives each day. Alzheimer's is a progressive brain disease that slowly destroys memory and thinking skills. It is the most common form of dementia, accounting for over 50% of all cases. Initially, Alzheimer's may present as occasional memory loss, but it progresses over time to severe disability, requiring constant care and supervision. Caring for someone with Alzheimer's can be emotionally and physically draining. Most cases of Alzheimer's occur sporadically, meaning they affect individuals without a family history of the disease. But about 1 in 5 patients have a close relative with the disease. Rare inherited mutations are linked to both the early and late onset of the disease. However, age is the primary risk factor for Alzheimer's disease, as its frequency increases significantly with age. This disease is most commonly found in individuals over the age of 80, while it is rare in those under 65-year-old. It remains unclear whether factors such as educational level, diet, and environment influence the onset and progression of the disease. In people with Alzheimer's, the brain shrinks, neurons die, and sticky clumps called amyloid plaques build up. These plaques block communication, spark inflammation, and trigger brain cell death. Although amyloid is not the only factor, tau tangles and other processes also play a major role. Amyloid buildup is considered one of the earliest and most characteristic changes in the disease, and it is a major target of modern Alzheimer's research and treatment trials. Alzheimer's typically begins subtly, often manifesting as forgetfulness regarding recent events, such as conversations, meetings, or the previous meal. These early symptoms are frequently mistaken for normal age-related forgetfulness. Although the memory of older events is initially retained, it too deteriorates over time. As the disease advances, symptoms become more pronounced. The affected individual often forgets appointments and names and struggles to find appropriate words. Spatial awareness diminishes, leading to incidents like bumping into objects, getting lost in familiar locations, such as stores, or failing to recognize familiar bus or train stations. Gradually, the ability of the individual to perform daily activities such as driving, managing finances, and remembering to turn off appliances becomes impaired. In the middle stage of the disease, affected individuals are unable to work, easily become disoriented, and require supervision. They may not recognize close family members such as spouses and children, and can become lost even when trying to find the bathroom or their bedroom. They struggle with dressing, eating, and even walking. Their abstract thinking capabilities decline, making it difficult to solve problems and make decisions. Simple tasks such as completing puzzles or drawing geometric shapes can become impossible, and even telling time may become challenging. During the late stage of the disease, many patients remain mobile but tend to wander aimlessly. They may develop delusional thoughts, such as believing they have been the victim of embezzlement or infidelity, or that an impostor has replaced their caregiver. Some may experience phenomena like a stranger in the house, where they believe objects are hidden or misplaced. Occasionally, they might perceive characters on television as real and argue with them. Sleep cycles become disrupted, leading to nighttime wandering, which can be distressing for family members. Many patients exhibit severe restlessness, roaming constantly, verbally and physically attacking those around them, and displaying sexually inappropriate behavior. In this phase, caring for the patient can be exceedingly tiring, prompting families to consider placement in specialized institutions. In the final stage of the disease, patients typically become immobile, bedridden, unable to speak, and lose control over their bowel movements. They require assistance with all basic activities, such as eating, dressing, maintaining hygiene, and using the toilet. Death in the patient with Alzheimer's usually results from complications such as malnutrition, infections, pulmonary embolism, and most commonly aspiration of food, water, or saliva. Alzheimer's disease cannot be diagnosed with a single test. Instead, diagnosis is primarily clinical, meaning it is made by a neurologist who gathers detailed information from the patient and their family members, along with conducting a thorough neurological examination. Neuropsychological testing, like the mini mental state examination and Montreal cognitive assessment, is often used in routine evaluation. If necessary, additional diagnostic tests may include laboratory tests and imaging techniques, such as MRI or CT scans, to rule out other causes of dementia. Treating a patient with Alzheimer's disease is very challenging. Currently, there is no medication that can halt the progression of the disease or restore lost functions. Therefore, treatment focuses on alleviating the symptoms and providing support for caregivers. Medications may be prescribed that can lead to moderate improvements in memory and cognitive functions for a limited time, such as cholinesterase inhibitors and NMDA receptor antagonists. However, these medications do not stop the disease from progressing. Recently, new treatments like lecanemab, an anti-amyloid antibody, have been approved for early Alzheimer's. These are the first therapies that may slow progression, though their benefits are modest, costly, and require careful monitoring. Antidepressants and antipsychotics may be used to address symptoms such as depression, aggression, or delusions. It is also recommended to use clear reminders, create a stress-free environment, maintain calming communication, and adapt the surroundings to help the patient feel safe. Changes in the environment can lead to increased confusion, restlessness, and aggression. As the disease advances, caregiving can become exhausting, making it a good idea to bring in a professional caregiver to help occasionally. As the disease progresses, patients often require constant supervision and assistance with daily activities. Consequently, caregivers may experience burnout, which might lead to decision to place the patient in the specialized care facility. The average life expectancy following a diagnosis of Alzheimer's disease is between 8 and 10 years. But this duration can vary significantly, ranging from 1 to 25 years. Other health problems strongly influence survival, and some patients decline faster than others. Alzheimer's disease is more than just memory loss. It is a long, difficult journey that reshapes lives. While science continues to search for a cure, what we can offer right now is understanding, patience, and compassion. For families and caregivers, the burden is heavy, but it's also a testament to the power of love as they stand by their loved ones even as the disease slowly takes them away. Though Alzheimer's cannot yet be stopped, awareness and early recognition can make a difference. With support, guidance, and empathy, patients can live with dignity, and caregivers can find strength in knowing they are not alone. In the end, Alzheimer's reminds us of something deeply human, that our memories and connections are precious, fragile, and worth cherishing every single day. Thanks for watching. If you found this video helpful, consider subscribing for more educational content. Have a great day.